welcome to intubation. We've got a patient here in cardiac arrest, so we'll go ahead and start out with the preparation for the intubation. So firstly, we want to make sure our patient's positioned well. So I've put a towel underneath his head to get the patient to the sniffing position. I've lined up the tragus with the sternal notch. That just gets the airway axes in alignment for a better chance at intubation. Next thing we're going to do is we're going to evaluate the difficulty of the intubation using the lemon mnemonic. So we're going to look externally on the patient, any sort of vomitus, beard, facial trauma, anything that would make intubation difficult. We're going to evaluate the patient's airway using the 3-3-2 rule, so 3 in the mouth, 3 from the bottom of the lip to the bottom of the chin, and 2 down to the larynx, and that seems okay. We're going to look for obstructions as well as obesity. This patient looks like he's not obese, and there's nothing that would occlude his airway, making it difficult. And lastly, we're going to look at his neck. Neck doesn't look too short. It's got good mobility, so that all looks like it'll be a relatively straightforward intubation. The next thing I'm going to do is I've laid out all my equipment here, so I've got my laryngoscope and airway equipment over here. I'm going to start doing some of the checks. So I've got a size 7 tube. I'm going to check that it inflates and that the cuff is working, which it is. I'm going to check the lights working on the blade, which it is, and I've got a size 3 blade here that I'm going to use for this patient. In addition to that, I've got another size blade over here, a size 4 blade, and a smaller tube, a size 6 tube in case I need to change something on the next intubation. On this side here, I've got my confirmation equipment, so I've got my stethoscope here to auscultate. I've got my end tidal hooked up to my bag valve mask, which I'll use to confirm placement. And I've also got my alternative airway in the form of an OPA and a bag valve mask in the event of a failed intubation. Now we're actually ready to complete the intubation. While we're doing this, I'm going to pre-oxygenate my patient for approximately 2 minutes or so. Indications for intubation: this patient's in cardiac arrest and at risk of having a poor airway, so I want to be able to secure it. Some of the benefits of having an ET tube in are that the patient's airway will be protected from aspiration. I can give drugs through it as well if I need to. And I'll be able to measure end tidal accurately with it. So now that my patient's been pre-oxygenated, I'm ready to complete the intubation. I've got my laryngoscope, size 3 blade here, a size 7 tube with stylet, and I'm going to insert the laryngoscope into the patient's mouth until I get to the follicular. I can visualize the cords now, so I'm going to pass the ET tube through the cords. I'm going to stop when I get to 23 at the patient's teeth. I've removed the laryngoscope, holding the tube in place. I'm going to inflate the cuff, continue holding the tube. I'm going to remove the stylet, and I'm going to secure the tube with a bite block that I've already prepared. I've secured the bite block, and now I'm going to place the end tidal with my BVM over the tube. I'm going to give a breath. I can visualize chest rise and fall. I'm going to have a listen to the abdomen and put a breath in. I don't hear any sounds above the abdomen, so I'm going to listen to each lung. I can hear in the right lung. I can hear in the left lung. Good air entry. And I've confirmed with end tidal. I'm looking for an end tidal of around 10 or 15 or so at this stage. So I'm happy that my tube's in the correct place.